For those of you who don't know me, I am currently chair of the PPN, and my day job is as lead psychologist at Lancashire Care NHS Foundation Trust. And I think I just feel really privileged to be standing here at the second annual conference of the Psychological Professions Network. And I think it's brilliant just to see so many of you. And I think I'd just like to thank you for valuing the PPN and actually making it a priority for you to attend, because I'm aware that it's not always that easy at the moment to get away and come to events like this. So it's just great to see you all here. I think it's been a busy 12 months since we were last here, and I think following on from last year's event, Claire and I have been following up on many of the suggestions, ideas and thoughts, and I won't talk about the details as Claire is going to be sharing some of those later, but there are a couple of highlights. For those of you who were here last year may remember the post-it note blizzard that we kind of engaged in. There were around about 538, give or take, post-it notes, and they were all had your thoughts, your ideas, your suggestions, and they've been typed up, analysed, and I think the priorities used to develop the network further. One thing, we're not using post-it notes today, as you might have noticed. I think my PA is just about speaking to me after last year, so move on from that. The key themes included sort of developing clinical expertise, such as CPD supervision. Wellbeing was a theme that emerged, which I think you'll see reflected in today's agenda. Suggestions on how we can use the network, events, the website, things about service user involvement, which is still a work in progress for us, and how we influence and widen our scope to include things around community and, say, public mental health, which again is reflected in today's agenda. Claire's going to explain more about these, and I think today's theme does pick it up. So far we've got over 1,100 members as of the end of January, which is just absolutely fantastic. So thank you, and please do encourage people to join, as many people as possible. And there's been an increasing number of hits on the website. We've had over 5,500 in December alone in terms of hits on the website, which I think just shows that it's reaching something, or reaching the parts that haven't been reached before. We've also collaborated with our healthcare scientists, allied health professions and pharmacy colleagues in the Centre for Professional Workforce Development in leadership development events. I'm delighted that PPN members have taken up that opportunity. 38 PPN members in total out of the 130 places have come to us. So I think that's great. So what's different about where we are compared to, say, 12 months ago? I think you'll have noticed there's been an increase in the profile of mental health and palliative esteem, which is encouraging. The landscape around us is changing, and with the general election looming, the political parties are promoting their policies around health and social care. You probably fall over them every time you turn on the news. And I think common themes include the need to consider mental health or psychological well-being, as well as integration of services in some form. And I think you'll see there's a change in the perceived importance of mental health, but the financial squeeze still goes on. And I think there's some recent statistics which I came across which I thought were quite interesting, that apparently the NHS deals with over 1 million patients every 36 hours, which in 2 months it'll have seen practically the whole population, which I thought was quite extraordinary. But there was something like 21.7 million outpatient and community contacts arranged for mental health services in 2013 and 14, which is a substantially lower number. And I think, yes, it's still a very big number, but in terms of 1 million people every 36 hours, it's substantially lower, and it probably shows we've got a way to go in terms of where we fit. Other stuff is that mental ill health represents, I think, nearly a quarter of all ill health in the UK, and it's the largest single cause of disability, but only 11% of England's annual secondary care health budget is spent on mental health services. So, parity of esteem? Maybe, but not yet. But I think what's encouraging is thinking about the access times for things like the IAP programme are planned to improve with increased funding, and also 50% of people with early psychosis will receive an intervention within 2 weeks. And mental health liaisons highlighted as an extra area of additional investment, but it's not quite clear how that's going to work out. So I don't think the investment proposed is actually going to address the kind of disparity between physical and mental health, but at least we seem to move in the right direction. And I think the other thing you'll probably have noticed out there is there's more attention paid to staff well-being and the importance of enabling staff to deliver the best possible care and interventions. Some of you, I'm not sure if any of you were at the New Savoy Partnership Conference on Psychological Therapies last month even, And there was a survey which reported on predominantly psychological professionals in IAP services. Sample size around about 850. And they all reported stressful working levels, or nearly all of them, but they said that their roles were very satisfying and interesting, which perhaps resonates a bit. But also of those participants, 40% reported feeling depressed all, often, or some of the time, and 42% reported feeling like a failure all, often, or some of the time. And I think that's a really worrying picture, and perhaps something that, as a network, we can think about. Alongside this, there's the Robert Francis report on whistleblowing, which you'll have seen out in the last couple of weeks. And I think that's a depressing picture of what happens to people who whistleblow. But one of the important recommendations is actually thinking that we should have a culture of reflective practice. And again, as psychological professionals, I think that's something that's very close to us and something that we value as being extremely important. Okay. So, what can we do to improve well-being for ourselves and for our patients and service users? I think I'd like to reflect on how we can develop, and I think I'd like to talk about the power of the collective and system leadership, which some of you have no doubt come across a lot more than me, I think provides a good example of this. So, leadership within the public sector and the NHS has been characterised by the kind of charismatic leader who sets the pace and is the figurehead for success and failure. We've kind of seen all those people that say, right, we shall boldly go and we shall do, but perhaps less around the collective. But what's been more promoted is the idea of collective or distributed leadership, where there may be a formal structure, but I think what's been done and been directed by whom is often situationally dependent and dependent on who's got the expertise at that moment. And that can be valuable, particularly at team level, and particularly where teams work well, and perhaps for us. The other aspects around system leadership, it's a learning organisation is characterised by that collective leadership, where people can work together and create better results. There's 5 components included in this in the literature: systems thinking, personal mastery, mental models, shared vision, and team learning. There's similarities for us as individual psychological professions, and I think we can think about how these help us in terms of navigating that landscape. I don't have the time to talk about all of this, probably less time than I planned, so I'm just going to sort of go for a few highlights. If we think about systems as a way of looking at organisations as a system of interrelationships, no surprises there. It's not that dissimilar from the concept of formulation as we apply it to understanding the issues of those who come to see us on a professional basis. By applying our skills to the organisations and the environments where we work, we can develop ourselves. And our roles in developing individuals and ourselves in personal mastery and in team learning are reliant on our skills as psychological professionals. I think one of the common themes for all of us is that we listen, we seek to understand, and we seek to enable and empower our clients, service users, patients, colleagues, team members, managers to overcome their difficulties and grow themselves. So, what does it take to actually do this effectively? There's been lots of recent articles on the concept of system leaders, and I think lots of learning experiences or courses that you can actually go on. And I think there's also something about what people should epitomise to make an effective contribution to collective leadership. The only name that I found that I recognised when a lot of these things were described, which is interesting, was Nelson Mandela's name, who was described as a systems leader for the changes he brought about in South Africa. But it wasn't just Nelson Mandela, obviously, that made the changes in South Africa. There were other well-known figures, Desmond Tutu, F.W. de Klerk, and a whole host of other people who contributed to the development of a new country. Now, few of us, I don't know, maybe some of you, would be able to compare our achievements and efforts with those of Nelson Mandela, but it's important to think about what he did and how and what we can learn from this, and how we can be contributors to that collective leadership. So, system leaders can be from many positions and don't always need to be at the top of the tree in either formal position or formal authority, although they do matter, and I'll talk about that a little bit more. Okay. 3 core capabilities are required to be a systems leader. And the first is to be able to see that larger system and not view only from one's own viewpoint. Sometimes we've observed that people find it difficult to see past their own particular viewpoint. Sometimes we find it difficult to see past our own particular viewpoints. But I guess if we can help people see the larger system, then we can build on that shared understanding to develop improvements and solve problems. So again, we're listening, we're trying to understand, and we're trying to enable and empower people. This may sound familiar to some of you in some of your clinical work. I think another core capability is to foster reflective conversation and generative conversations, which is another interesting way of describing the world. I'll quote very briefly about what the descriptions of reflection are within the systems leadership literature, which means thinking about our thinking, holding up the mirror to see the taken for granted assumptions we carry into any conversation, and appreciating how our mental models may limit us. Deep shared reflection is a critical step in enabling groups of organisations and individuals to actually hear a point of view different from their own, and to appreciate emotionally as well as cognitively each other's reality. This is an essential doorway for building trust, where distrust has prevailed, and for fostering collective creativity. I think, I don't think any of us as psychological professionals would not value the practice of reflection for themselves as practitioners, and are also in supporting the people with whom we work to undertake reflection, whether we define them as patients, service users, clients, or staff. So again, I think we're listening, we're still trying to understand, and we are still trying to foster self-empowerment. But what is a generative conversation then? So apparently it has people engaged in the sharing of perspectives, questions and ideas that produce a common understanding and help identify a common sense of direction or conclusion. Does that sound familiar to any of you in any of your practice? And I think we focus on collaboration, and we focus on a shared understanding of the journey that our clients want to take, however we define them. And we have different labels for this. Without it, how could we actually work therapeutically? And the third capability is focusing collectively on co-creating the future rather than problem solving on a sort of reactive basis. It's not to say we don't need to problem solve, but there are other, it's probably not just losing the reactive versus the proactive. We're often prompted to change because of our own dissatisfaction with our current conditions. And organisationally this is true, although the drivers may be others, whether they're targets, commissioners, regulators. But in co-creating the future, it isn't enough just to inspire with a vision of the future, but it's important to recognise what is difficult about the present and enable the bridge building to move to that desired future. So again, our work as psychological professionals epitomises this journey for the people we seek to help, and also perhaps ourselves as we seek to become more effective. We help our clients to identify what's difficult and help them develop ways of changing and managing their lives to enable and empower them to develop their own desired future. So, an example came to mind, and it's, in a way, it's a slightly minor example. It's about a client I saw some time ago. And she described one of her difficulties, and there were a lot, that she had as being unable to get to sleep. So we talked this through with her, and she said she went to bed and she sort of lay there and she thought, well, look at all the stuff I haven't done. I haven't done this, I've still got to do that. And then talking through her day further, she had actually achieved a lot in a day in terms of managing the psychological issues she'd come to see me with, but she'd also was looking after several children, studying full-time, looking after a house, etc. So we came up with a plan, which, as we agreed, she'd try thinking about what she'd actually achieved in a day rather than what she hadn't. So our next meeting was 2 weeks later. So I was slightly cautious and inquiring about how this had gone. And she enthusiastically told me that it was great and that she was sleeping much better. So I sat there and thought, I wonder whether I should try that. But there we go. Physician, heal thyself. A psychological professional, take your own advice. So what's this all mean? I think there's many capabilities that psychological professionals have that epitomise systems leadership, and we're capable of articulating these in a wider framework, and I know many of you do. Also, we don't need to be at the top of a hierarchical tree to always make that difference. And again, I've got another example. Approximately a year ago, I attended and presented at a day in compassionate care organised by Health Education North West. I was really chuffed to present my own work on staff wellbeing, so it was a great opportunity. The morning was focused on Schwartz rounds, which were presented by the UK licence holder, the Point of Care Foundation. Many of you will know what Schwartz rounds are, but very briefly, for those of you who don't, they're basically a setup where professionals can get together to hear the story about cases, potentially difficult cases, to actually sort of reflect on the emotional impact of caring for people. They primarily have been focused on acute organisations, but colleagues in the room are progressing work in terms of taking that further into mental health and community trusts. So yeah, it was interesting. So following the day, Health Education North West invited organisations to bid for support to develop Schwartz rounds in their organisations. To be fair, I didn't give it a lot of thought. I was still bathing in the reflected glory of actually being asked to present something of my own. But I had a colleague who works as a psychotherapist with adults with learning disabilities contact me. She had attended the day too and asked me whether there were any plans to bid. So through an email and phone conversation, she convinced me that bidding would be a good thing. She'd also followed it up with conversations with the Point of Care Foundation, which indicated that perhaps our organisation, as a community and mental health one, would be a good area to develop Schwartz rounds. So with her gentle prompting and encouragement, I did get the bid together, and I did get the support from our directors and our chief executive. And we actually made the bid, and we were successful. And I think one of the reasons of sharing that example is I think it shows what we can do as system leaders, wherever we sit in a structure. Both my colleague for encouraging and supporting me to do something, and I think my role as psychology lead in my trust in terms of engaging the trust management to take this forward. So, how does all this relate to the PPN? The Psychological Professions Network isn't about formal structure and hierarchy, although we do have some of these features: workforce boards, steering groups, chairs. I think the Psychological Professions Network is a community of practice that seeks to bring people together and to promote psychological approaches. This isn't something that can be done just by a few, and it isn't something that will stay relevant if it is just done by a few. Developing special interest groups, sub-communities, in areas such as counselling, leadership and IAPT, cognitive behavioural therapy, clinical leads, they're intended to support the development of a learning community and support the development of self-sustaining networks and communities. Our skills epitomise the principles of systems leadership, and while it may be articulated in the language of leadership and management theory, I think it's still listen, understand, enable and empower. So the PPN's fortunate in that it has system leaders who supported the collective leadership that started the network. And I think the support of Health Education North West and its leaders, and in particular Neil McLaughlin, who unfortunately can't be here today, with funding and resources has been essential. And without it, the PPN would have really struggled to make the progress it has made in such a short time. But to grow and flourish, it will always need more. And the systems leaders are all of us in this room and our colleagues who couldn't actually make it today. So we have ideas, we can share them, and we can create something new that improves the well-being of the people with whom we work. The Psychological Professions Network can be the home or the environment, whatever you prefer, that helps us do this and provides support for our development, and the PPN would not exist without that input from you. I think I'd really like to thank you for your input so far, and please keep it coming and help us build our network for the future. But perhaps an email rather than a post-it note. I'm still recovering from those. So you'll see in your, Claire's already mentioned it, but you'll see on your tables and in your packs that I'd like you to think about NHS Change Day, which is next week on the 11th of March, which is intended to be a grassroots movement that's about harnessing collective energy to change something in our environments or something in ourselves or something that we do to improve the work that we do. So perhaps there's something that you could think about that you could do to lead and develop the work of the Psychological Professions Network wherever you are. We did wonder about calling it Purple Pledge, but I'll perhaps not go down that road. So there'll be more of that later, and I'd just like to say thank you for coming.